Hello, everybody. How you doing? That was a great presentation right before mine. I love those AICR guidelines, and I'm just so appreciative of all the people that do all that hard work so that we can look at it and take it in, right? I'm deeply grateful. My talk's going to be a little bit different. Everybody here is interested in food, and we're talking a lot. Is meat good, meat bad, you know? I was thinking you don't ever need to eat processed meat. It's like, wow, all those people that love bacon, right? I mean, so it's interesting talking to people about food. I want to actually talk a little bit about, like, what is food packaged in? And what do we store food in? And what about the water coming out of our tap? And does any of this have anything to do with our endocrine system? Now, we just went through this exquisite rundown of evidence and how we're weighting it and the methodology and just really rigorous sort of detail. And I'm going to just tell you, what do you do when you are in the world of really incomplete information? Because clinicians, when we sit in an office with somebody, all of that information is very useful, but we live in a world of uncertainty, and we're trying to do the very best we can for the people that we're there to serve. So I'll show you where we are today. I'll also acknowledge where the gaps are, but I would hope that at some place we would remind ourselves, especially when we're talking about pregnant women and young children, that it is not unreasonable to invoke the precautionary principle when we're looking at where the risk can be so great, and the remedies to avoid some of them can be so simple, I don't have any relevant disclosures to make. Our learning objectives for you all to know what we're going to talk about. So an endocrine disruptor, if we go to the Endocrine Society and ask them, how do you define it? They first of all say it's an exogenous chemical. It's not something inside of us, or a mixture of those chemicals, which is what I will contend we're really dealing with, is we're bathed in a soup of these chemicals, thousands of them on a daily basis, that interfere with any aspect of hormone health. Well, all of us know that the endocrine system is this finely tuned hormonal cycle or system that is so critical that it's working properly throughout our life, but it is most critical that it's working especially in utero and the first 36 months of a child's life. Those consequences that may occur later in life, things that we're talking about, obesity. Yeah, we can talk about obesity as being too many calories and not enough exercise. Those are clearly the places we're going to start. But is there any evidence at all that there may be things that we're exposed to for decades that impact our metabolism in a way that could alter the microbiome to make us be able to more efficiently extract energy or calories from food and to store them? This is a very interesting part of this whole endocrine disruption that we're talking about, are potential obesogens, as well as things that affect estrogen and androgen activity in the body. One of the things that I think is so complicated about trying to get your arms around endocrine disruptors that we're exposed to is that we tend to study these one at a time. So we study bisphenol A. We'll study a particular phthalate. We'll study PCB. We study things in isolation to understand them. And we still use a Paracelsian paradigm, meaning Paracelsus was the one that said the dose determines the poison. There is nothing that's not a poison. That's what he said. Everything's a poison. It just depends upon the dose. Well, that's great for looking for acute toxicity, right? You just keep giving a certain number of animals, usually rodents, an increasing, escalating amount until 50% of them die. You can also do subchronic toxicity, where you can give them varying levels of a substance, and then you can sacrifice them, and then, interesting term, but you can sacrifice them for our need to know. And you can see if there's any organ disruption, if there was toxicity. I mean, so we have a lot of this methodology that we use, but how do you actually study, other than biomonitoring, how do you actually study low-dose exposure to chemicals over 5 decades, 6 decades. So you and I can say that our great-grandparents have a lot of differences. We live a life that's very different than our great-grandparents or our great-great-grandparents. But I will tell you one thing, we're seeing a lot of heart disease and cancer today. We're seeing a lot of cancers, more than we did then, and it's not just life expectancy. And the Endocrine Society itself believes that in part why we're seeing some of these hormone-driven cancers is a contribution of these endocrine-disrupting compounds. We have done a lot to limit exposures to like BPA. We've banned some of the phthalates in children's products, but we have done nothing for pregnant women. There's nothing. So, you know, the tippy cup and the baby bottle, we've removed BPA and we've taken phthalates out of a lot of the baby toys and things like that. But probably if you stepped back and look, what is mom putting on her skin? What is she putting in the microwave? Where's she getting her beans from? Are they cans? I mean, if you step back and start to look at all the levels of exposure, you'll find that we've done virtually nothing when it comes to the prenatal or the pregnant woman. If we think of the potential for these endocrine disrupting compounds, things that really, you know, and just let me just state for a moment, let me just go back for just a second, you know, when we're thinking about those most sensitive times, I want you to just like in your mind think, you know, in a baby that's 4 weeks in utero, 4 weeks, woman's 4 weeks pregnant, that baby's 4 weeks old, you got 10,000 sort of neurologic brain cells. By the time that baby is 24 weeks in utero, there are 10 billion cells. 10,000 to 10 billion in 20 weeks. Now, whenever you've got that much cellular division, whenever you've got this much growth happening, those hormones have to be delivered in precise amounts at the precise time for tissues and organs and neurons, everything to develop in an organized fashion. Imagine now if you're exposed to chemical mixtures that are altering the way those hormones are delivered in a baby that is growing at that pace during that time. So it's why, you know, it is so important for us to talk about, you know, what's a healthy diet for periconception, what's a healthy diet for pregnant women. We want women to breastfeed. Yes, I know all of that. But this is like the thing we never want to really talk about, is like all of these exposures. And I've often wondered why. You know, my daughter, I think, gave me some insight. She's like, Mom, it's just like, unless you tell people what they can do, it just seems like overwhelming and it just seems like a terrible thing. And so you want to make sure that in your own practices, you're able to counsel your clients, your patients, in a way that is reasonable and makes sense. And I'll tell you, it's a lot easier to help people get rid of their plastic than it is for them to get rid of their bacon. Okay? No, just saying. Just saying. Some of this stuff is fairly straightforward. So we do know that the data is suggesting a role. Doesn't mean that it's the only thing at play. We're complex creatures living in a complex environment, so none of these are all due to one thing. But we do know that there is an association with earlier puberty. I mean, look at these girls that are 9 years old now starting their period. I mean, 9 years old, having their first period, you know? When I was a girl, I remember we all went and watched the movie while the boys went someplace else, basketball or whatever, you know. But we went and saw the movie. But we didn't see the movie in second grade. This implication for having a longer exposure to estrogen, starting at 9, because menopause, going through, increases the risk of some of the estrogen-driven cancers. But I also just want you to think, from an individual and a societal perspective, what happens when you have a bunch of 9-year-old girls entering their reproductive period with all of the things that go along with breast development and menstruation? It's not just body fat. We account for body fat. We do believe that we're seeing a contribution here, truly, of these endocrine disrupting compounds. Unbalanced sex ratios. You know, unbalanced sex ratios are more prevalent and easy to identify in amphibians and fish. right? So we know what some of these endocrine disrupting compounds do. So a number of these chemicals we have seen actually feminize male frogs, right? So that pretty soon you just have female frogs. I know some of you are thinking, what is a frog? What would it matter? Well, let me just tell you as a biologist, I think about those things. What would happen if there were no more frogs? They play a significant role in the food chain. Lots of animals eat frogs, but what do frogs eat? Lots of mosquitoes. Lots of mosquitoes. What is one of the most dangerous insect vectors for the spread of disease? Mosquitoes and ticks, but mosquitoes. So imagine if we just lost all the frogs. Well, you don't have to go far. India already did that experiment. Back in the 2000s, when India was selling most of their frog legs to Europe, huge amount of frog legs, by the way. I mean, I was kind of blown away by the data. They actually had to ban the export of frog legs because they could not afford the insecticides to keep the mosquito populations under control. All of these things are connected. So when we look at amphibians, which have survived 3 mass extinctions, amphibians have lived through 3 mass extinctions, and we are afraid they'll actually die out under our tenure on the planet. Amphibians are interesting from a biological perspective because they're both terrestrial and marine animals. They live in the land and they live on water and they breathe air. And so when you're looking as a biologist, you're just looking at what potentially could be harmful in the environment. Using amphibians as a model is an interesting one. So I'm going to present human data today, but let me tell you the data that when we look at fish, when we look at amphibians, when we look at frogs, this data, the pathways are quite elegant that have been worked out. So when we look at endocrine disrupting compounds, we do know that exposures to them over time definitely can decrease estrogen levels. They can decrease the egg quality, the number of antral follicles. We know that it can diminish the number of pregnancies and successful pregnancy outcomes. So definitely when we're interested in women's health and we're talking to women about their health and their reproductive health, you cannot not have a conversation around exposures to these compounds. Now, we're talking a lot about pregnancy and we talked about puberty. What about premature ovarian failure? I mean, this is an issue that we're also seeing. About 1 in 4 of these cases, we have no idea why these women their ovaries are failing, literally not able to produce any more eggs at such a young age, in their 30s, early 40s. Many women today are having children older. They have careers, they have things they're doing, so they're getting pregnant older, and they're finding they're not able to. We do know that tobacco smoke, so smoking is one, but also pesticides, phthalates, and BPA are associated with this loss of healthy follicles at a younger age. So BPA, really interesting, first synthesized 1891. So it's been around a long time, and we knew it was an estrogen in the 1930s. We were going to use it as an estrogen, but we came up with diethylstilbestrol, DES, and thought that might be a better thing, right? So BPA just sort of went to the side. It wasn't used as an estrogenic chemical, but there's no question it's an estrogen and acts like an estrogen in the body and in the environment. It's used in hard, rigid plastics, right? I mean, it's used in those hard, rigid plastics. It's used in a lot of the metal food cans, and the more acidic the food, the more likely it's going to have BPA lining the can so that the acid doesn't eat into the can itself. It's in thermal receipts, you know, and it's like if you had a woman who works as a cashier at a store where they're giving receipts out, just a simple thing is to just tell her while she's working just to wear gloves, just plastic gloves, you know, or cotton glove, but to wear a glove while she's actually not handling all those receipts all day long. So this was a big review that was done actually in Europe, a European review, looking at the 4 sort of main female effects that we see from estrogen disruption. We know it's a complex pathway, but we believe all of these pathways have one thing in common. They are due to disrupted estrogen pathways. Female reproduction, cystic ovaries. How many of you seen people with polycystic ovaries? Yeah, #1 cause of infertility in women in the United States, and growing. And what do we use to treat it? We use metformin, often. We use it because this seems to be a problem with insulin sensitivity and insulin resistance. And isn't it interesting that BPA and phthalates also affect insulin sensitivity, right? It also can alter uterine morphology and impact fertility. So long-term association with BPA. Mammary gland development, which also can impact young girls with early pregnancy, early menarche. Cognitive function and metabolism, increasing insulin resistance. All of these pathways have this estrogen pathway sort of at its core. Now, we did a lot with BPA to try to make sure it was not in the baby's bottles, and moms were putting them in the microwave, and so we were heating the milk inside the baby bottle, you know, to give it to the baby. So we banned those, but BPA is present in a lot of things, and I'll also talk about the BPA-free problem that we have now too. What if BPA, and I was told at a conference that I should never say this in another conference, and so you know what, I am 61 years old, and I'll just say whatever I doggone well please, okay? So just, you know, whatever. But I wonder, you know, this, we know that our sex is determined genetically, right? Generally XXXY, sometimes a Turner's or other things, but generally it's determined genetically. But your hormones, the gonadal hormones, are what determine the male and female phenotype. So all of these hormones that you're exposed to in utero. There is a serious question about, does this bathing in utero of these babies at critical windows, does it alter in a real way their phenotypical expression? Now, you know, I can be in places and people are like, oh, they're just confused kids. You know, they're just confused about their gender and everything. And for me, I'm sort of like, well, maybe there is that. And I think gender bending has been around for a long time. But it's a little bit like the canary in the coal mine. You know, it's kind of like, wow, the canary dropped dead. Huh, must have not eaten well. I mean, the whole reason the canary was there was to see if there was poisonous gases. What if this is a grand experiment, and that actually some of this confusion that children are going through is because actually in utero, they were not clearly defined their phenotype? It's an interesting question, and I think it's ridiculous to not just pose it as a question. I'm not saying it's a fact. I'm saying there's growing data that suggests that not only is this happening, but some of these effects may be transgenerational. That it's an epigenetic effect, and that some of these effects may not just be for the baby I'm carrying, but for the baby that comes next. Not unlike lead toxicity, it's not just the child who's born whose mother was exposed to lead that's harmed. It's her grandchildren as well. These epigenetic effects, very interesting, and things to ponder. Just questions to be asked. Is it all clear? No. You know, we had the big Clarity BPA NTP study that was done. They did progressively higher doses in rats, and they did not find adverse effects for BPA. They didn't see it. However, you've also got the National Institutes of Health, their environmental groups, the researchers that are funding a lot of studies, including at Columbia, I mean, major academic centers that are clearly showing problems with obesity, behavioral issues, attention issues in children whose mothers have high levels of urinary BPA metabolites. When you look at the data, I'd say, for me, I'm sort of like, well, you know, you pull 10 studies and you're looking at them. Some were measuring these metabolites using different methods. So some were using a gas chromatograph, some were using HPTLC. I mean, some of them were measuring. Others had different outcomes that they were looking for. Some were short studies, some were long. We already know that there's a lot of problems with translation of rodent models. It's enough to sort of say you should limit your BPA where you can, right? Just like you can have a hot dog if you go to a ball game. Well, yeah, you can have some things here and there, but in general, in your home, you want to limit these as much as possible. So what about all these BPA-free cans? You seen those? BPA-free. And it's a can, and it's highly acidic, and it's like BPA-free. So I called one of the companies. Just said, I see it's BPA-free. It's very cool. I opened up my can, and it's very good, because the inside of my can is really nice. It's got a nice white coat inside of it. I was just wondering, if you're not using BPA, what are you using? Well, first of all, nobody wants to answer your question. And then you got to call back and sort of say, I'm an academic professor, I'm affiliated, you know. And then we're using BPA-S. We're using BPS, not BPS. BPS. I'm like, what is that? It's a BPA analog. I'm like, what do we know about that? Not much, apparently. Not much, apparently. And of course, then I went right to Whole Foods, and I was like, you know, I pay a little extra money to come shop here. And so when I'm looking at a bunch of cans and it says BPA-free, I think it's a little not good on your part not to let me know that this is not BPA, but it's bisphenol S. National Toxicology Program actually said, we better expand what we're looking at for bisphenol A to some of these other structural analogs, because, hey, well, guess what? They seem to have basically the same activity as BPA, but a number of these have them at lower concentrations, so you don't even have to be exposed to as much. We've known about BPA since 1891. These new analogs, we know nothing about. But how many of you, if you saw a BPA-free can, would go, great, that's what I'm looking for, right? So you know, this is sometimes the devil you know versus the devil you don't, right? With this. But be careful with some of these BPA-free canned products. Many of them are using these structural analogs. It's pretty simple, and it wasn't that inconsistent with what many of you have do already, and also what you heard even when we were talking about cancer. Fresh foods, fresh or frozen. Limit the amount of cans, and then use them in cartons instead of cans for things that you need. Do not microwave foods or beverages in plastic containers or with plastic cling wrap. I mean, our daughter, I'd make leftovers, I'd put it in a Tupperware, kind of like, not the brand, but that kind of plastic container, put it in the fridge, and I'd tell her, just take out what you want, put it in a bowl, and put a paper towel on it if you're gonna take some out. Oh, she never could be bothered. She never could be bothered. She'd take the whole dang thing and stick it in the microwave, and heat up the entire leftover that could feed a small army, right? And never could take it. So finally my husband just said, honey, just win the war. Quit fighting the battles. Throw all that plastic stuff away and just go get yourself some nice glass stuff. I went to Crate & Barrel. I just got all this nice glass, and it was interesting. We haven't had any plastic in the house that we stored anything in. You know, she's 25. This happened when she was like 12. So it's been a long time. We don't have it. And my mother, who's in her late 80s, years ago when she came, she said to my father, she says, don't you like things stored in glass? We used to always store things in glass. When did we all start storing stuff in plastic? She doesn't even know any of this, but somewhere instinctively inside of her, she thought glass was better than plastic. Hand wash your plastic containers if you're going to have them. Use glass, porcelain, stainless steel. Use the other things. Avoid cans when possible. Watch out for those BPA-free ones. Say no to your thermal receipt. Of course, that's a touchy one, because if you say no, then they're like, well, can I have your email address? I'll email it to you. And I'm like, no, I don't want spam. You know, so you want to have some kind of receipt, right? So this one, I think, is more important for people who are exposed to this on a daily basis, not so much an individual taking a thermal receipt. And avoid plastics with recycling number 7 on them. They don't all have BPA, but many of them do. So it's a simple thing. So when you're talking to your patients about their food, one of the things is like, how do you store your leftovers? What do you store your leftovers in? It's kind of just a simple one. And say, well, I want you to get rid of the plastic. I'd like you to, save some of your glass jars, and you can wash those and use those to store things in. Get some glass containers. These are some sort of simple things. Look on the bottom of your plastic. Anything that's got a 7 on them, those are things you probably don't want to use. Make sure nobody's heating anything in plastic. If you got meat and you're defrosting it, make sure you take that plastic wrap off it, those kind of things. I know many of you do this already, but you'd be surprised how many patients say nobody's ever told me that. They've never said anything to me. So these are simple things that can be done. Now, what about phthalates? Well, these are human-made, man-made. I changed it to human-made because women might be making these things too, you know. So human-made chemicals. We use them in, you know, that vinyl flooring. I don't know if you saw, Home Depot is going to be phasing out their vinyl flooring that's got phthalates in it. So things are changing, you know, things are changing. Wall coverings, toys, but not for the youngest, because we've banned a lot of phthalates for very young children's toys. They're in blood bags, IV tubing, preemies that are born very early. They get very high phthalate levels, and there's strong movement to make all NICUs use non-phthalate types of bags and IV tubing. And of course, they're in a lot of personal care products and in all those things you like to spray in your room to make them smell good, right? So all those fragrances, those ain't essential oils, folks. Those are all phthalate-ridden synthetic fragrances, and you're just spraying them everywhere. And so they're in a lot of things. We've done a good job. I want to say the government's done a good job with trying to get some of these phthalates out of the marketplace. We've banned a number of them in children's products, and now labs actually have to test for a number of these phthalates. They got to have independent lab testing. Interesting, even though these have been banned in young children's products, the FDA is very clear that they have never said that phthalates are not harmful. We're just going to take them out of the kids' products, but we're not going to say that they're not good for you. Okay, cool. These orthophthalates, though, this is currently being looked at by the FDA right now. All of these that you're getting exposed to because they're in food packaging. So these that are being absorbed by the mouth through the mucosa, these orthophthalates, those we don't have the data on yet. They're still being investigated. So let's just look at some of these NIH-funded studies at like Columbia and UC Davis and some of the others. Let's just sort of look at them. This is one where they measured the phthalates in, they measured 6 different phthalates in women during their late pregnancy in their urine. And then they followed their children out at ages 3, 5, and 7 years of age. And they were looking at their phthalate levels. They were doing all kinds of tests on this cohort of children. At age 11, which is about the time you would do this, you're looking at motor proficiency. Okay, so the animal data suggests that there is an alteration in motor, in motor skills in animals that are exposed to higher phthalates. So what they did find in this research is that girls who were exposed prenatally to higher amounts of phthalates had much poorer motor function. They didn't see it in boys. What they saw in the boys is that when they were exposed in childhood, because don't forget these kids were being followed at 3, 5, 7, and then at 11, kids who were exposed to this during their childhood actually had poor motor skills and motor proficiency. This we see a lot, that some of these endocrine disrupting compounds affect females and males differently, and at what window of exposure. Now, some of you just may be going, motor proficiency, what does this really matter? Well, if it was just how well you could catch the ball, it'd be one thing. But Columbia's study in New York, 328 inner city moms and their children who were followed for an extensive amount of time. They were measuring phthalates in the pregnancy. They followed these kids out at age 3 and 7, and at 7 they also administered an IQ test that we use in children. So when you look at the relationship between the mother's urinary metabolites of phthalate in her pregnancy, and then you look at the children, there was an inverse relationship. The moms who had the highest levels of phthalates, those children scored in a statistically significant way child processing speed, perceptual reasoning, working memory, verbal comprehension, perceptual reasoning. There was a couple specific phthalates in particular, those highest levels were associated with lower IQ. Now, you look at this and go 6 points, 7.5 points, 7.6 points. That actually is quite significant. This is an interesting phenomenon because I will tell you, children today are fundamentally different than children 30 years ago. And pediatricians will tell you this. Pediatricians who've been pediatricians a long time will say, I've never seen this many kids that are being diagnosed with attention problems, with inability to concentrate. It's like the number of children on Concerta, on Ritalin, on methamphetamines, things that we keep them on often, and now they're adults. They're still taking them. Does any of this have to do in any way, is this a 1%, 10%, 15% contribution more? That's kind of scary. We had two big studies, one from Sweden, and then the TIDES study done here in the United States that actually looked at phthalates and found a statistically significant association with language delay based on the mother's levels of phthalates. So it wasn't just in the United States. We've seen this in Scandinavia as well. And particular metabolites from DEHP, one of the phthalates, those metabolites are the ones that have been associated with shortening the anogenital distance in male babies. What does that mean? Well, it means that the testis and the anus are in closer proximity, which affects sperm quality, motility, and numbers. What we know is that, and these are just a few of the studies. I'm focusing primarily on phthalates impacts, especially in young children when women are pregnant. But what we know is that use of plastic containers are associated with higher urinary phthalates, and use of cans is associated with higher BPA metabolites. And that people who choose healthier diets, fewer fast foods, fewer, processed foods, more organically grown, grass-fed, raised kinds of beef. When you look at these types of healthier food patterns, you actually see lower urinary phthalates and BPA. There was a dietary intervention done where they just did it for 3 days. And I want you to really hear this. This was just a 3-day intervention with pre, during, and post levels of phthalates and BPA. And 3 days of an organic diet where the food was not delivered nor stored in plastic. So, wrapped in papers, put in glass. This wasn't delivered in plastic. Just in 3 days, they reduced the BPA concentrations in the urine by 66% and DEHPs by more than 50%. In 3 days. So, we were hearing earlier, healthy weight, physical activity, fresh foods, more vegetables, wholesome kinds of foods, less processed. We're all swimming in the same direction. We're all basically saying the same thing. I just want us to be thoughtful around what we're storing the food in. It's not just the food. I'd be curious how much of our cancer research actually looks at, were they eating this food served in plastic? Were they storing it in plastic? Were they eating their beans in cans? Or were they, Instapotting it, or doing, lentils? These are questions that often do not make it into a lot of our research because we don't think about it. We just don't think about it. Phthalates have definitely been shown to increase insulin resistance. Insulin resistance is its own problem because we need to be metabolically healthy, right? We need to be insulin sensitive. There's a number of things that are associated with diabetes in addition to phthalates. And this whole area of exploration, which, again, could this be playing a role? Clearly, if you're eating 3,000 calories per day and you're only using 1,500, you're going to gain weight, right? And if you're never physically active, you're going to lose muscle mass and you'll probably also gain weight. But is there a role for any of these compounds? Some people say if you just look at the calories consumed and you look at the obesity epidemic that has happened in this country since 1993, where you had no state that had more than 15% of its population that was obese, and now we have a whole number of states where the 35 to 40% of the people living in those states are obese. Is that just calories? Some people say no. Could be early antibiotic exposure, children that get too many antibiotics too early that may be altering the gut microbiome. Those of you who've read Martin Blazer's work with the Microbiome Project. And then there's this whole section on how some of these definitely act as obesogens, meaning, and we think this is being modulated through the gut microbiome, but they definitely, in animals, you can give them to an animal, just put it in their drinking water, give them some of these compounds, put it in their drinking water, give them exactly the same physical activity and exactly the same food. The only thing you've changed is putting it in their drinking water, and they get fat, and they become insulin resistant. So if you're talking to them about their diet anyway and they're trying to manage their weight, this should not be the primary focus, but it should be included in your buffet of things that you're offering, is also just saying, and we want to get rid of anything that might be mucking around with your endocrine system. We just want to get those out of your diet. So I want you storing foods, and then you can have the conversation. So these are the number 3 recycling on the package, right? So 3s and 7s. So 3s and 7s are the ones you remember. Avoid foods with plastic wrap and packaging whenever possible, whenever possible. When we go to the store and I go to the butcher to get chicken, I ask them to wrap it in butcher paper. They do. They got a whole big thing of butcher paper, just wrap it, and they put the little thing on it. So there's ways that you can limit. You're never going to avoid it all, but you can limit, you can reduce it. Don't heat your foods in plastic, same kind of things. And be very careful about fragrances. So, when you look on a label, it doesn't have to say it contains phthalates. But if it says fragrance on it, fragrance almost by default means it contains phthalates, right? So what do I tell moms? Especially moms, but dads too. I just see more women. I want you buying stuff like what you'd put on a baby. I want stuff designed for babies. So lotions that you use should be like what you're using on a baby. It should be fragrance-free, no smell, no odor. I said, everybody will appreciate it. Like, is there anything worse than being in an elevator with somebody who comes on with a lot of cologne or perfume? You're just like, oh my God. It's horrible. And it's like, we actually don't smell bad. We smell good. Most healthy people just have a normal smell. So quit putting all the cucumber, melon, kind of raspberry cream stuff all over you. And and most parents, when you say, I want you for you and for your 10-year-old daughter and for your 13-year-old boy, I want you mostly buying things that are hypoallergenic, things that are fragrance-free. Be careful. Please don't use your detergent now they've got the extra fragrance pod. Have you seen that? I don't remember which detergent company it is, but it's got your pod, and then it's got the extra one that does nothing to clean your clothes. It just gets more smell in it. And I'm like, well, that's a terrible idea. So get rid of the smells as much as possible, and then filtration on the tap water is important. We're going to talk a little bit more about that in a moment. But activated charcoal, even a pitcher. The old pitcher stuff that you put the water in and set it out on your cabinet or put it in your fridge, it gets rid of most of these things. It's amazing, just something as simple as that. They're not expensive. Most people can afford them. Reverse osmosis is more expensive. It's a more expensive process. You can hook it up to your kitchen, but most people can afford a basic filtration for their drinking water for them and their families. Parabens, won't spend a lot of time on this other than to say, we've set limits on them because they're a problem. They're estrogenic and they're anti-androgenic. And parabens, because of their problems, have been limited how much a single amount of paraben can be or a multiple mixture of these parabens can be in cosmetics and skincare. What we know now is that basically if you look at the paraben level in the mother's serum, it's basically same in the amniotic fluid. When I was training to be a midwife, it's like, we thought, wow, there's 2 great barriers for babies. There's the placenta. Nothing gets past that. That's like, they just major defense. And then the blood-brain barrier, right, in the baby. So it's like, nothing's going to get past all that. Well, now we know basically the placenta is a leaky sieve. Lots of things get in, and a lot of these things can cross into the baby's brain. So when we look at the mom's level of paraben in her serum, we see that it's almost identical in the amniotic fluid. So the baby is being exposed to these at the same degree the mom is. So this is the big study here in California, up in the valley, your Central Valley, where this Salinas study has been going on, the Salinas Valley has been going on for quite some time. 338 kids, and they're followed from prenatal through birth through adolescence, right? So we've got this huge cohort that we're following out for a long time. What we see is that in girls, those girls who have higher levels of parabens in their body around puberty, they go into puberty earlier. Yep, they get earlier pubic hair development, they have earlier breast bud development, and earlier menarche with propyl and methylparabens. So boys also, they were more sensitive to propylparaben, not the methyls, but they also had earlier genital development. So here we've got a cohort, and we're taking all kinds of confounders, because this cohort, we're looking at pesticide exposures, and we're looking at drug use, and we're looking at all, food, we're looking at all kinds of things. And this holds true. So, and we also know that this same study, published just this year, found that prenatal exposure to DEHP, so when the moms were pregnant and if she was exposed to this, and triclosan, which everybody thought was a great idea to put in antibacterial soaps and make the entire nation take it, were associated with earlier menarche in girls. And so I do want to point out that the FDA did ban the use of triclosan in antibacterial soaps, not only because it had endocrine disrupting properties, but because they're no more effective than just soap and water. Just wash your hands with soap and water. Just plain old soap and water. This is what I mean. It's like, now this is looking at parabens, but now let's layer on the phthalates, and let's layer on the BPA, and let's just layer things on that we're not even talking about. Dioxins, PCBs, some of these persistent organic pollutants. I don't know. Seems like there's a reason to try to limit exposures when possible. You can buy this stuff paraben-free now, and you can just tell, you can tell your patients, you can just counsel them. Also on skincare kind of stuff, I know we're talking about food. Also just want to talk to you about things you might be putting on your body. Parabens, you can buy things that are paraben-free for you and your family. This is particularly important if you have children, right? Because girls love putting smelly things on them. And just remember, a cosmetic, this is a hard industry, because anytime you mix anything with water, it's going straight to hell. It is, because anytime you mix anything with water, it starts to go bad within days, right? So you got to put a preservative in it. Parabens have long been used as a preservative, but there are other ones that are safer that you don't have to use. So parabens are just another one that's an endocrine disruptive substance that women can be exposed to. And last but not least, I'll just end on pesticides. And is there a reason to recommend organic? So there's the environmental perspective, how much of these pesticides do we want to continue putting into the environment? And then there's a human health question. So if we look at the systematic reviews and the meta-analyses that have been done in the US and abroad, in other countries as well, in both agricultural settings where people are going to have more exposure to pesticides because they're being used on farms and farmland where people are more exposed to this in rural settings. But if you look at them in urban and in rural settings, we know that the organophosphate pesticides, that babies who are exposed to this in utero, there is a correlation, just like we see in the animals, with poor cognition, social development, behavioral development, et cetera. The study that looked at chlorpyrifos, which is a member of these types of families, the organophosphate and organochlorine pesticides, got a lot of attention. If you were a mom and were pregnant within 1.5 kilometers of where this was being sprayed, this particular pesticide, your child had a statistically significant increased likelihood of being diagnosed with an autistic spectrum diagnosis. Now, we know that this autistic spectrum diagnosis has expanded, and people have debated, are we actually seeing more autism? Have we broadened the definition of what autism is? Is that why we're seeing more? But it's like, and I get it, parents are very concerned about vaccinations. I understand it. When it's your kid, it doesn't matter if it's 1 in 1,000. If it's your child, it's 50-50. They've had a reaction or not to the vaccine. I get it. But it's like the amount of things that they're exposed to in that vaccine is infinitesimal compared to the daily exposure that many of these kids have to these pesticides, which clearly have a biological basis for mucking up our neurochemistry. Many of these pesticides were nerve gas that were used in the war, and they were slightly altered so they would be toxic to the neurochemistry of insects, but not people. Whoa. Maybe they're not just monkeying around with insects' neurological systems. In July 2019, the European Union decided that they were not going to renew the license for chlorpyrifos. They were not going to renew it. A number of their member countries have never allowed it. The UK banned it, and of course, it remains being used here. It was going to be, we have set limits on it, so I want to give the government credit where there has been work done back in 2014, 2015, limiting, like saying you can't use it on tomatoes, we're going to limit the amount on apples, we're going to limit the amount on grapes, we're going to say that if you're going to put it in a house, it's got to be inside of an ant trap, it can't be out where kids can be exposed. So, I mean, so there was some good things that were made. The point is, what happens when science, politics, and lobbying collide? What happens? Because they were going to ban this stuff, and we got a new administration. And I'm not making any comment about, I could, but I won't, about any administration at all. I'm not. But what happens when the science is not complete, when there's huge amounts of dollars at stake? And when you say that the science is incomplete, what does that actually mean when we're talking about our babies? What does it really mean? So for me, some of these are worse than others. Some of these pesticides are worse than others. Everybody's on the glyphosate Roundup march. And if I had to pick my poisons, that wouldn't have been the one I'd gone after first, right? There are other worse players in the marketplace. We have sprayed pesticides throughout our shared environment. Shared. They are now in amniotic fluid, they're in our blood, they're in our urine, they're in our exhaled breath, because you breathe these pesticides when they're sprayed. They're in mother's milk. What is the burden of cancer that we can attribute to this use of poisons in our agricultural system? We won't really know the answer until we do the other experiment, which is to take the poisons out of our food chain, embrace a different kind of agriculture, and see what happens. So I don't know that that's going to happen. I think that the links with cancer, I think people are still exploring that, but there's no question the links with endocrine disruption, and there's no question that in utero and during the first few years of a child's life through puberty, that the risks of exposures, cumulative exposures to multiple mixtures of these compounds can be harmful. To reduce exposures, where do they live? Where do they work? Right? You always want to ask, where do you live? Where do you work? Right? I live in Pecos. I live an hour outside of Santa Fe. We're got agricultural fields. Where do you live? Where do you work? Right? And do you take off your shoes when you come back in when you've been out farming? Do you take off? Do you take off your clothes? Do you take off your shoes? Put on fresh when you come into the house? I mean, some of the simple things that can be done. Ask about their water source. A lot of people in the United States are still on wells. A lot of people don't realize that live in cities, but like 1 in 4 households are still on wells in the United States. There's a lot of people that use well water, myself included. I ask patients, when's the last time you had your well checked? Crickets, crickets, crickets. I'm not sure we've ever had our well checked. How long you live there? Oh, it's my mom and daddy's place. I'm like, okay, so you've lived there 50 years, never had the water checked once, okay. It is recommended that the water be checked annually, so, but it's one of those things. It's like, well, the state water, every state's got a water place that you can send the water in to have it tested, right? It is one of the problems, though, because groundwater, where a lot of this well water is coming from, when you start looking at it for a lot of endocrine disrupting compounds, there's a lot of it in there. So it is important to have it checked. Know if your community has implemented a registry where they'll notify before they do mass spraying for like mosquitoes or for mass spraying for other types of insects. This is a big one in urban areas where golf courses, neighborhoods have mass spraying to keep down mosquitoes because they're an incredible vector for disease. That's one of the places you could sort of say it kind of makes sense to still have that until we come up with other and better ways to keep control of mosquitoes. But many cities now have implemented where you can actually be notified by email on the date and time so that you'll be inside, the animals can be inside, you shut the windows. I mean, there's things to be able to reduce exposure, so you can be on the registry. Be an advocate for integrated pest management. I did not show the slide, but the pediatric journal, American Academy of Pediatrics, their pediatric journal back in 2015 did a meta-analysis of 16 studies looking at indoor residential pesticides, so inside, in the house, residential exposures, and found a strong, statistically significant correlation with lymphoma and leukemia in those children. And it is interesting when you look at clusters where there is more of these types of leukemias or blood-borne cancers, and you look at them in large tenement buildings, big apartments, a lot of times people who are most socioeconomically disadvantaged, where they're spraying all the time for cockroaches, they're spraying all the time for bugs. The PTA, the USDA, the U.S. Preventive Task Force have all recommended that daycares, businesses, schools, and residential homes use integrated pest management, which you call basically any pest control place, like an Orkin or something, and you just say, I need to have somebody come over, we've got cockroaches, we got whatever, and you say, I would like integrated pest management. It's about $20 more, and it's almost all barrier methods. When our daughter moved to Portland and she saw water cockroaches coming up from the drain and she's panicking, the child, she could deal with rattlesnakes, but not water cockroaches. New Mexico, we don't have these things. So I said, well, here's what you do, honey. And then I said, ask for this. So anyway, she did. Nobody was surprised. Came over, spent 3.5 hours. They were under the house, plugging up all the areas where bugs and stuff come up through the floors and around the pipes. That's integrated, mostly barrier, which allows you to use much, much less pesticide in the house. So these are other things you can just talk to patients about. Dust and vacuum. We use a HEPA vacuum. You know, it's just got a HEPA filter on it to help get more of the dust and things out of the house. And counsel patients about the dietary modifications. Use organic where you can. Wash your produce well. You know, when I was a kid, my mom's like, did you wash that apple? And you're like, yeah, you know, the old gene wash, right? As you run out the door. Nobody ever washed anything. So, you know, I just took it upon myself when I buy strawberries, raspberries, blueberries, when I get anything, I just wash them all and I put them in a glass container so they're all ready to go. So they get eaten more when they're already cleaned and done. You know, a little yogurt, you know, they're good to go. But wash the produce. Peel off outer levels of the leafy veggies, remove peels, trim the fat, the skin from your meats, from your poultries, from your fish, because this is where most of these compounds accumulate, is in fat. In our fat, as well as the animals that we're consuming, right? So these are some of the ways that we can talk to our patients about this. Some things will be individual that we are going to be able to help them do, and other things are public policies. They're policies. And we have got to be able, you know, if I was queen for the day, I would say I want to invest in better analytical models so that we can study actually complex mixtures of these compounds and what their actual impact are. I want better modeling, better methodology, better analytical tools for looking at these complex matrices and how they impact human biology and physiology. I would want there to be science plus the precautionary principle when it comes to federal limits on things that are allowed in food and water, especially water. I want us to use science, but there's never going to be settled science. If you want settled science, be a physics person. I mean, there's only a couple laws, like the law of thermodynamics, the law of gravity. If you're in this field, you live with uncertainty. So for me, it's like we're always going to have unsettled science, and it's just so convenient to say it. What I would say is, how do we use science and the precautionary principle to be able to make reasonable limits for exposures? I think that there should be better labeling of phthalates, BPA and BPA analogs, parabens and other things on labels, and there should be cautionary statements for pregnant women because we don't have them currently. Though, I will say, I somewhat am cautious about cautionary labels because I walked into this building and it said, this facility has chemicals that are known to cause cancer by the state of California. And you're sort of like what? Like if I walk through, just breathe the air? I mean, so I think that these have to be reasonable, but there needs to be a way to communicate this to the public. I would also say that I think that pharmaceuticals, which are also a problem in our water, pharmaceuticals and chemical companies should have to pay part of the burden for cleaning these things out of our water. And I say that honestly because we know that membrane technologies, we're already finding newer technologies that can remove a lot of this in our municipal water system because a lot of these are not. They're in your tap water. So have them help us to fund to be able to change our municipal water systems to be able to better extract these compounds that can interfere with our endocrine system. And last but not least, I would just say, what if in a resilient human being, we should be able to resist many things, right? We should have good resiliency, we should be very strong. But what if we've done things inadvertently that has made this worse? Like, what if some of these neurotoxic effects are more pronounced in a population that's choline deficient? Choline necessary for the healthy development of the brain. Robert Friedman's lab at the University of Colorado clearly showed pregnant women were given 900 milligrams of choline per day as phosphatidylcholine, or they were given a placebo, and those children were followed out. At 5 weeks, they put them in a lab, took the babies at 5 weeks of age, and they put them in, hooked them up to EEGs. It'd be scary if you're a kid, but anyway, EEG. And then they started doing clicking sounds in the lab and monitoring them on EEG. Now, in a normal, healthy person, your brain just tunes it out fairly quickly, right? Because it's just a sound that you just inhibit the excitation in the brain. 70+% of the kids who'd been given choline, the mothers who'd taken choline, had an extinguishing effect very quickly. Just a little bit more than 40%, or almost half that number, that had gotten the placebo had that effect. Meaning that they were continuing to be stressed, they were continuing to feel this. What I'm saying is, are there also changes that we've made in our diet that may have been protective, but now we don't eat egg yolks very much anymore? Nobody eats liver anymore. God, walk in the house, you'd know mom was cooking liver. Man, just smelled the whole house up. She gave it to us like once a week, right? Because she thought liver was so good for us. Well, turns out it's loaded in choline. Maybe it was good. So I'm a student. I'm a student. I will be a student, I hope, till I die. I'm really interested in the questions. I'm really interested in thinking about some of these complex questions for which there's not easy answers for, but there are some easy suggestions for you that you can do in your own practice that are not that hard. Number 3, number 7, paraben-free. Use a water filtration pitcher for you and your family to drink out of, right? You know, don't spray things for cockroaches. Get an integrated pest management. Don't store things in plastic. Don't heat things in plastic. Use things in glass. Buy fresh and frozen. Limit your exposure to canned goods or use them in a carton. These are simple things people can do that actually could have big benefits generation-wise for our children and our children's children. I hope you got something out of the talk. Thank you for listening.